Special Diets, Chapter 24, Dietetics textbook. So first is the purine restricted diet for patients who suffer from gout. Okay, gout. I'll show you the images later. What is gout? It's a kind of arthritis. Okay, it affects the joints. Okay, uric acid. If when the body has too much of uric acid in the bloodstream, this extra uric acid will get deposited in the joints and all, and it will lead to inflammation, arthritis, etc. Okay, so when the body produces uric acid and when it metabolizes the chemical compounds called purines, uric acid when it is metabolized, you get purines. Okay, these extra purines will be deposited in the joints. Okay, that leads to inflammation of the joints and anatomical changes will be seen in the joints. Okay, so too much of uric acid in the bloodstream called hyperuricemia. In certain people, hyperuricemia leads to gout, and it's a common form of arthritis. So it can be developed because of the following reasons. Your body is either producing too much of uric acid, okay, or there is too much of uric acid rich food in your diet, like certain fruits and all. Okay, when and sometimes it's the genetic cause also. Even though you are having the normal amount of food like any other healthy adults, but because of some genetic metabolic errors, okay, your body is digesting uric acid faster than other vitamins. Okay, so this is how gout look like. Okay, a swollen and inflamed joint, masses of uric acid gets deposited in the joint area, and uric acid crystal formation will also take place here, and from outside it looks like this. Okay, this is a kind of gout. So in these conditions, even if you have a genetic disorder related to uric acid, or you're suffering from gout, for those patients, purine restricted diet is given. So these are the things which you have to avoid. Restricted diet means these are the things you have to avoid. Organ and glandular meats like liver, kidneys, okay, heart, of any non-vegetarian food sources you should avoid. You can only have the uh, fleshy part of it, not the organs, like the boneless chicken and all. Okay, that's fine. Boneless chicken is fine. Then beverages, the sweetened high fructose corn syrup, alcohol had to be avoided. So excessive smoking, excessive body weight, crash diet or high protein diet has to be avoided. These things you can take in limitation, in moderation. Red meat in moderation, fish which is high in purines like anchovies, sardines, okay, scallops, shellfish, etc. Poultry also in moderation. Ideally, limit yourself from non-vegetarian food. Fruit juice also in moderation. Alcohol, as per the doctor's advice. Okay, table sugar, honey, these also artificial sweeteners, even jaggery. Okay, salt in moderation. You can have pulses. Pulses is not an issue. You can enjoy plant proteins like tofu, legumes, nut, butter, whole grains, pulses, cereals, etc., vegetables. Okay, yogurt, dairy food, eggs. Eggs are the only consideration you get from purine restricted diet. It is different. Rheumatic arthritis is different than gouty arthritis. Okay, the reason why rheumatic arthritis, the pathophysiology of rheumatic arthritis is different from gout. Okay, in gout you will get uric acid disposition in the joints, that gives you gouty arthritis. So low fat diet, milk or non fat diet, skim tone milk, water, at least 68 to 16 cups during flare ups when you're suffering from that particular arthritic flare up. Unsweetened tea and coffee only if you're habitual at that point. Whole fruit, that is unsweetened, regular exercise. Vegetarian diet also has uric acid, that is highly sweetened fruits like oranges that are too sweet. Okay, sweet lime like mosambi and all, too sweet, so that those things are restricted. And fruit juices, you can't have fruit juices. Next, coming to ketogenic diet or keto diet. Okay, it's very commonly known nowadays, ketogenic diet. So why did ketogenic diet come into place, come into existence in the first place? It was not for weight loss. Okay, ketogenic diet was never planned for weight loss. Ketogenic helped out pediatric patients as well as adult patients, children and adults who were suffering from this irretractable epilepsy. Okay, seizures, fits, convulsions. Okay, to give them a nutritional guidance to control their frequent episodes of epilepsy and fits. For that particular reason, doctors came up with this ketogenic diet. And even in that case, when it comes about pediatrics, okay, for 2 years, the child is supposed to follow the ketogenic diet, and slowly, you will add more carbohydrates into the child's diet. Okay, parents are given the advice of it, when to stop, when to start, how much to add, etc. The parents are the best guide for their worship. Okay, so that was why ketogenic diet came into existence in the first place. But there was also the side, not we can say side effect, the um, extra something which they have found out, that while focusing on ketogenic diet, there was a considerable loss in fat, as well as the way how the body metabolizes fat. Okay, the body chooses to metabolize fat first and later go on to carbohydrate. Okay, ketogenic diet is not completely devoid of carbohydrates. 5% of the energy should come from carbohydrate. That's for your brain and central nervous system. Okay, fits and epilepsy is also called as seizures. Okay, some children have this fits episodes, na convulsion, fits. So these are the signs and symptoms of irretractable epilepsy or seizures. Staring into space, when they look like they're staring into the space, but their central nervous system is hyperactive. Okay, like there is too much of signals, too much of signals to which the nervous system can respond. Too much of neurotransmitters are being emitted um, at a very small duration of time. That's how you get epilepsies. Okay, convulsions, like the body will shake, there will be some froth coming out of the mouth. For some people, saliva will become very frothy. Okay, falling, because when you are in the state of fits epilepsy, you do not have your neuromotor control. Okay, usually these people fall down. Blackouts, loss of bladder and bowel control, same, whatever comes under the sympathetic and parasympathetic nerve system. Okay, everything will be out of control. You yourself cannot control these motions. Okay, when you go into the state of epilepsy. Stiff muscles, biting of tongue. Okay, so these are the symptoms of epilepsy. To treat this particular condition, to make sure that the frequency of epilepsy which the child is suffering from, it reduces drastically, that's when ketogenic diet came into existence. Okay, it was never designed for weight loss, and also it was never designed for a long term goal. Okay, we do not have evidences in which a person is following ketogenic diet for the past 10 years or more, something like that. We do not have enough data on that. We do not know the long term effect of that. So that is the reason why, even in kids, those who are suffering from this medical condition, or adults who are suffering from this particular medical condition, for them only 2 years of keto diet is recommended. Post that, slowly the carbohydrate intake will be increased. Okay, so this is the medical guideline for it. So this is how you make a food pyramid out of, or food composition out of, for ketogenic diet. The highest portion of your food will be from fat. 70 to 80% of your daily calories should come from fat sources. 20 to 25 can come from protein, and remaining only 5 to 10% will come from carbohydrate. Okay, and the percent, how much of the exact portion size, how much of the exact percentage of carb should be added, how much extra exact percentage of protein should be added, that completely depends on the person's medical condition. Okay, if you see significant changes in their health after you slowly start introducing the carbohydrates, and you can maintain 10 to 15% of carbohydrates. Okay, otherwise if the body is triggered by carbohydrates at that point of time, you can reduce it less than 5%. Okay, but at least 5% should be given. um, 5% of carbohydrate should be given to make sure that the brain is healthy, brain gets its glucose requirement from carbohydrates. Okay, so fruits, potatoes, alcohol, rice, bread, sugar. Okay, this is completely avoided when you are in a keto diet. These are the things you have to completely avoid. It's not about thermic effect. We are not talking about thermic effect here. We are talking about the mechanism of action, specifically in people who suffer from epilepsy. Okay, those who suffer from epilepsy, thermic effect of foods or weight loss are not the goal. Okay, to keep their brain functioning healthy, and to keep them from not falling frequently because of fits, biting their tongue off, etc. To that is the priority. Okay, safety of the patient is priority. Thermic effect does not relate to ketogenic diet. Okay, so ketogenic diet for people who suffer from diabetes, it is seen that there's a reduction in blood insulin level, increased mitochondriogenesis, too much of mitochondria produced in the cell, reverse of hepatic insulin resistance. So it is good as well as bad. Okay, when there is a reverse of hepatic insulin resistance, it's a good thing. Okay, insulin resistance can be treated, but you can see the first point, that is a reduction in the blood insulin level. Okay, so they will be dependent on insulin or diabetic medications, etc. Cardiovascular parameters, so increased LDL particles are seen. There is reduction in HMG coenzyme A, etc. Reductase activity. These are enzymes. Okay, reverse in blood insulin level. Weight reduction is just an added benefit to it. So the entire marketing of keto diet was done based on weight reduction. Okay, the other underlying factors on how keto diets will affect a diabetic person, a person who suffers from cardiovascular diseases, and who actually requires ketogenic diet, people who suffer from epilepsy. Okay, these things got lost in translation because the entire of the community, nutritional community, was focused on weight loss via keto diet. Okay, so it's just an added benefit, but it's not the only goal of ketogenic diet. Okay, reduction in your appetite, your lipogenesis, the way how lipids are formed, increased lyolysis, breakdown of lipids, metabolic cost of neogenesis, that is new glycogen glucose being formed by glycogen stores in the body, and thermic effect of proteins are increased. Usually proteins do not have much of a thermic effect as you compare it, if you compare it to carbohydrates and all, but when you are following ketogenic diet, your body visualizes protein as something that has naturally high heat, and it tries to digest it faster. And how ketogenic diet helps with people suffering from epilepsy. It influences on the neurotransmitter activity, as I mentioned earlier. When you are having fits or convulsions, what happens is that the neurotransmitters are releasing too much of chemical signals which the body cannot react on time. Okay, so that's when you get the fits and convulsions, and you are not aware of it. The person who suffers from convulsions, when they come out of that threat, they do not know how long they had been in this convulsive state, how much time has been passed. They are not aware of the surroundings when they go into fits or epilepsy. Okay, that's an anti-convulsant effect of this keto diet, ketone bodies on in the body. That's the reason why this is beneficial. Reduced neuronal excitability. When the neurons are too much excited, that's when they release too much of chemical signals causing fits. mTOR pathway in sports nutrition, we have just discussed. mTOR pathway is mTOR is a switch which is used by insulin as well as leucine. That's a kind of protein. Okay, this which helps you to maintain the secretion of growth hormone. Okay, and when your body is deficient of insulin, your body is not producing insulin. When your body is deficient of protein, the growth hormone will not be switched on. Okay, so that is mTOR pathway. Next, coming to paleo diet. Okay, again, this is also very popularly known among the celebrity cultures and weight loss dietitians, etc. In its purest form, what paleo means is that the cavemen, our ancestors, okay, the cavemen, what kind of food they had, okay, when people, humans used to live in caves and all, they used to hunt down their food on a daily basis. And usually we humans during that time and all, stone age and all, we followed a nomadic kind of um, lifestyle. There was no civilizations then. Civilizations is when you see a village or a small village nearby the coast of any river or anything, and population starts to flood in and they settle down. They do not move from that. That becomes their native place. Okay, that's the starting point of a civilization. Okay, but before that, how were humans? They were nomadics. Okay, they were nomads going from one point to another, are always in fight with wild animals, either for fighting for the same food or hunting down also wild animals to make them their food. Okay, so that was the caveman era, the stone age, what we call it as the stone age. Okay, so what kind of diet they had followed, okay, this millions of years ago, what kind of diet the cavemen followed, you follow the same pattern. Okay, so processed foods will not be included. Pulses, cereals like rice, dal, okay, these things were not there during your caveman era. It's when the civilization formed, agriculture took a boost, and that's when you grew this pulses, cereals, etc. Okay, so pulses, cereals, legumes and all that is out of the paleo diet. Okay, it's usually wild fruits, vegetables, meat. Okay, so these are the things that consist of paleo diet. So when the cavemen, when they first roamed the planet around 2.5 million years ago, what kind of food they were, what kind of foods were accessible to them? Always remember this: the fruits and vegetables which you see nowadays in market, do you think it was is in the same form millions of years ago, or did they evolve? Are the fruits and vegetables which we have right now, is there a evolution factor? It is obviously evolved. Okay, if and it is still evolving because of genetic engineering. Okay, nowadays you get these seedless fruits and vegetables. Okay, tomatoes without seeds. Okay, these are results of genetic engineering. If you go and see the difference between a desi tomato, okay, ingrown tomato, and a hybrid one, you will know the difference what the genetic engineering had made. Okay, so nowadays, the evolution of fruits and vegetables is rapid as compared to 2.5 million years ago. So obviously, along with that evolution, we did lose a lot of vitamins, minerals, factors from the foods. Remember this thing: the soil quality is degrading day by day. Our agricultural soil quality is degrading day by day. So whatever recommended daily allowances and whatever portion size is mentioned in the textbook, for 100 gram of egg or 100 gram of spinach, this is the amount of iron you will get, this is the amount of calcium you will get, whatever is mentioned, we can't take it for the word. Okay, because we do not know which kind of soil quality was used for the agriculture. Always remember, the soil quality is getting degraded day by day. So that degradation will also be seen in the amount of vitamins and minerals present in your food which you eat. Okay, so in ketogenic diet, the main source of food, the main source of energy is fat. Second, protein, and finally, only 5% of energy is carbohydrates. That's it. That's keto. Paleo, it doesn't mean paleo doesn't go for this caloric value. It's the sourcing of food. I'll show you the examples of paleo diet. The diet can improve your health by eliminating high fat diet, because see, when people were nomads and all, There was no food processing, there was no food, processed food. Whatever was available to you in its raw form, without using this visible fat. See, visible fat and all, it came into existence when civilization was formed. Okay, before that, how did they get their fat? When they kill the animal, when they hunt down their food, when they roast it. Okay, they don't roast it using oil and all, they just used to do dry roasting of their food. Okay, they're not using extra ghee or any visible fat. They didn't had the access of using visible fats. So obviously you are eliminating high fat diet, high fat items from the diet. Processed food that have little nutritional value nowadays, which is very commonly used, that was not available in those years. And too many calories, because whatever they used to hunt down, okay, even if it is one animal or so, it had to be shared between that entire caveman community. Okay, so too much of indulgence was also not seen. Okay, whatever is available to them, they have to share it. Okay, and eat it and go for the next hunt. So these are the things which, the left side, okay, it comes under paleo diet, things that you can include in paleo diet, and on the right side, which are not included in paleo diet. Okay, in keto diet, it doesn't matter. In keto diet, you are using processed food. Okay, the low carb food, but which are still processed, you can use it. Also, you are using visible fat like olive oil, etc. Visible fats will be used in keto diet, so that doesn't make it a paleo diet. Okay, so vegetables, all vegetables, fruits, shoots, herbs, etc., you can use it. Fruits, nuts, wild meats. Okay, hunted down meats, not the one which, if for example you have this desi chicken, or grass this free roaming chicken. Okay, and then you have boiler chicken. Okay, which do you think comes under paleo diet? You have two options. One is this free roaming chickens. Okay, and then you have the broiler chicken. Which do you think comes under the category of paleo diet? Yes, the free roaming chicken. Okay. Also, for the grass-fed cattles or non-grass-fed cattle, the dairy which you get from grass-fed cattles and all, that is more of a paleo. But again, dairy will not come under a paleo diet, because those days when man had the epiphany to use the dairy from cattle, that's when civilization started. So that is one of the reason why in Hinduism and all, and even for some other religions, but mainly in Hinduism, you can see why there is such a argument on eating beef and not eating beef. Okay, the reason, the apart from the religious reason, apart from keeping the spiritual and divine reasons away. Okay, just focusing on what could have happened that made this cow a very holy animal for Hindus. The main reason should be that maybe man discovered the benefits of using the dairy from cow, and just you, not just by making it into milk, but forming animal fat out of it, like ghee, butter. Okay, and making into curd, and some other all the other dairy products is coming from one main source of one main animal. So that could be the reason why it is considered holy. We do not know, we do not have evidence of anything spiritual or divine associated, but this could be a reason why killing a cow may be something that is very unholy for Hindus. Okay, that could be a reason. Okay, so obviously religion does evolves after time, after again. This is just an example. So that is the reason why in paleo diet they are selecting wild meats. Okay, the meat which you hunt down, which you will not like usually when you go to some South American countries and all, or even South of America, like or North of America, Montana, okay, such states in America, you can see people are diverting themselves from the mass killed animal meat, and even if they're non-vegetarians, they are going for hunted animal meats like the deer meat, etc., which you can hunt down. They always you all know about the gun laws in America, right? So the most of the households, they do own their rifles, etc. They go on camping trips, hunting trips. They will hunt down a deer or any wild animal, and they will cook it and enjoy it for their time being. But they will not go for mass produced meat like processed meat, sausages and all, which is sourced from mass killing of animals. That is not used. Okay, so these are the reasons why paleo diet picked up its course over the period of years. Again, you have weight loss benefits from it because you are not adding processed items into this diet. You are not adding too much of visible fats. The only visible fat that is allowed here is olive oil and coconut oil. Not even butter or animal sourced fats. It is not allowed here. Okay, so that's about paleo diet. But paleo diet also has its drawback. For example, the kind of microorganisms and the kind of nutrition, okay, the fruits and vegetables and these wild meats were able to give to human beings 2.5 million years ago is completely different from today's day and age. On top of that, the microorganisms, the flora, okay, which you have inside your gut, okay, inside a human being, that is also completely different. When we say we humans have evolved from our caveman state, it doesn't mean just physically the outerwards, how you look, okay, and how you dress. It's not just that. Evolution is much more deeper. Okay, at a microscopic level also evolutions does take place. So that could be a reason why paleo diet cannot be followed for long term. We do not have evidence of the benefits or even side effects of paleo diet for long term. We do not have research on that. Okay, so for a time being, if you want to drastically give a cultural shock to yourself, if you want to just shock your body with some new nutrient, you just want to try it out for rapid weight loss, and along with that, good health. If you want to follow that for a specific period of time, you can follow this, and then slowly you can incorporate readily available legumes, pulses, that is like readily available throughout your country. Okay, when you travel and all this, following your paleo diet regimen is difficult. Okay, so next, coming to the diet in cleft lip and cleft palate. Again, could you please answer this question? Which vitamin deficiency causes in women, in pregnant women, which deficiency will cause or have a high risk of a baby born with cleft lip, cleft palate, or spina bifida? Which vitamin deficiency? Which vitamin deficiency during pregnancy could lead to cleft lip or any neural tube defects? Yes, it is folic acid. Vitamin B, the entire vitamin B complexes should not be taken lightly. Okay, specifically folic acid. Okay, that's the reason why iron as well as folic acid tablets are given to pregnant women. Okay, so these are different types of cleft lip. How a normal palate looks like. Children who have unilateral, only one side of cleft lip, bilateral cleft lip, both the side. From the nostrils, there is an opening up till the tonsils. So feeding the baby, you have to be sure that the child's swallow reflex, okay, the child's reflex will be affected because there is no upper palate. Okay, the upper palate area will be empty. Whatever you feed the child, if it goes into the nasal cavity, it will go easily into the trachea, and the child may suffer from aspiration. And if aspiration takes place, what is the next risk factor? What may happen? Can you just name a disease that is very life threatening for children if they aspirate on food? People who are from medical field can answer it. And this particular disease is very common, not just with children who suffer from cleft lip or cleft palate, but also for other healthy kids. If the milk what they drink or any feeding what they are having, if they aspirate on it, aspirate means the things that are supposed to go in your food pipe, it goes into your windpipe. Okay, so there is an aspiration reflex. Yes, pneumonia. Okay, cyanose aspiration pneumonia, that's a medical terminology, but pneumonia. Okay, children suffer from pneumonia if there is too much of foreign bodies inside their lungs, specifically caused by aspiration. So to prevent this aspiration, the child is held at a 45-degree angle. You can see how the mother is feeding the child, at what degree angle she's making it. So naturally the gravity will make sure that the food goes into the stomach. Okay, if you hold the child in 180-degree or slightly lower, if you don't keep the head on the upper side, obviously the gravity will not function well and the child will aspirate on the food. And again, you have specific feeding bottles like these. Okay, these are for children who suffer from cleft lip. These are specific feeding bottles. The midwives as well as the gynec nurses or your obstetrician could help you, will guide you. The mothers who have given birth to cleft lip children, they will be given guidelines on how to use these feeding bottles. Okay, so as I have mentioned earlier, when the child does not have this upper palate, okay, or the mouth that is joined, okay, so the sucking reflex will not be that strong. Even if the child tries to suck on the mother's breast milk or on the bottle's nipple, etc., the child does not get this completely full formed circle around the nipple area. So for that particular reason, these feeding bottles, if you see, so in this case the mother is, for example, in some cases the mothers, they lie down. Okay, they lie down and they try to give the milk, breastfeed the child. Okay, that is not recommended. Okay, or you may have to keep the child in such a way that the child is at the nipple level, the head of the child is at the nipple level, but rest of the body of the child is lower. It is somewhere near your pelvic region. Okay, rest of the body is somewhere near your pelvic region. Okay, if you are able to hold the child in that position, okay, along with some help from others, where you can also make sure that this position can be held. And the next best option is go for a breast pump. Okay, pump out the use a breast pump out your breast milk, and then put that in this particular feeding bottle, cleft palate feeding bottle, and feed the child. That's the best possible version.